everyone, and welcome to Clinical Resumes and CV webinar. My name is Callie Nelson. My pronouns are she, her, hers. I am the Graduate Assistant for Graduate Student and Postdoc Advising and Programs at UConn Center for Career Development at the Storrs campus. Before we get started, I'd like to go over a few items so you know how to participate in this webinar. You should see your attendee interface on your computer desktop in the upper left corner. You will have the opportunity to submit questions by typing your questions into the chat pane of the control panel. You may send in your questions at any time during this presentation. Since this is a previously recorded webinar, these questions will be emailed to the center and answered within 3 to 5 business days. Note that a recording of today's webinar will be emailed to you within 24 hours. There is also a short evaluation that will appear at the end of the webinar for you to complete. So here are some of today's topics. We will be talking about resumes and CVs in general overview. We'll also talk about sections and content for resumes. We'll also do some bullet statement practice, which you'll have to do on your own, but we'll go over some things that you could do to practice. Sections and content for CVs. Okay, so now starting out with resume versus CV. So I get a lot of questions about what's the difference between a resume and a CV? Should I apply with a CV or a resume as a graduate student? So this blender is a good example because it shows things like experiences, skills, knowledge, and putting all those things into a blender, and that would be like your CV. So it's all these different parts of your life, and it's a lot more, takes up a lot more space. In resumes, it's really distilled down into something that's easier to consume. So to create the resume, you choose what to put into a result into a concentrated product, which ends up being your resume. A resume in the U.S. cultural context just demonstrates one fit by identifying recent experiences, skills, and knowledge that are relevant to the career field, job, or internship posting. So for CVs, people usually have one master CV, which has all the things that they've ever done. And then based on the job description, they will choose information to include in the resume. So your CV can be longer than 2 pages, but then you can choose which information to put in for your resume. So what exactly is a resume? It is a document that presents critical and relevant information to the reader or external audience. So this is really what you are in your professional context. So again, this can be different for each job that you're applying for, each clinical thing that you're applying for. And it's really what the highlights that you want them to see. It's typically a 1 or 2 page document that highlights education, background experiences, accomplishments, skills, and interest. For clinical resumes, they're very frequently 2 pages. If you're in graduate school, or even if you're just doing clinical resumes, it's totally fine to do a 2-page resume. I know that there are a lot of things around there that says that resumes have to be 1 page. Totally fine to be 2 pages. And for a lot of experiences, it's more appropriate to have a 2-page resume. But of course, length may vary depending on the industry and depth of experience. So if you're applying for your first clinical position or your first practicum, you might not have as many experiences as somebody who's applying for their last or looking for jobs in the field. So most important document in marketing yourself professionally. So you usually apply with a resume, a cover letter, and then sometimes some other things, but the resume is really what people look at. That's what they look at the most, and that gives them usually the first idea of who you are and what your professional skills are. And the goal is to get an interview. So the resume helps you get the interview, and the interview helps you get the job. So here are some general rules and general structure with resumes. So they are 1 to 2 pages, like I said. This is an example of a nursing resume. Margins are 1/2 inch to 1 inch. That is going into the normal margin in Microsoft Word or the narrow margins. I tend to prefer the narrow margins because you can get a lot more information on there, but that's something that you can choose around, like you can play around with when you're deciding what information to put on there. Font size can be anywhere from 10.5 to 12. We do recommend with resumes that you go all the way to the bottom of the page. So if you have about 1.5 pages worth of information, you should really see if there's anything that you can add to make it all the way down to 2 pages or to condense it into 1 page. That's something that you can do with margins and with font sizes. So be consistent with format. This is something that's difficult to do, and it can also be helpful to have somebody else take a look at your resume just because there's so many different parts of it. It can be difficult to keep the structure. I know a lot of people will say, well, I get a lot of people asking me like, is there a particular format I should do? Should I do the, should I center in the middle? Should I center it to the left? It really doesn't matter. It's really what you think is going to look the best and what looks the most professional. the resume is really the reflection of you professionally. So if you think that it looks professional and that it's a good reflection of you, then that's what you should do. Just make sure it's consistent with everywhere, consistent through the rest of the document. And I'll see the bold and italics consistently. So if you go over to the education section, there's an underline there. I would want to do an underline for the clinical experience and certification and other areas too. So just make sure to be consistent with that. Choose a common font, so Times New Roman or Garamond. Those are the fonts that are things that we see the most. It shouldn't be anything more exciting than that. Usually, some people say that resumes look kind of boring. Honestly, yeah, they do look a little bit boring, but it's because you want to fit in as much information as possible, and this is usually what people expect in the US cultural context. So even adding pictures or adding different font isn't really going to help you. It's going to probably make people think that that's a little bit out of the ordinary. So it's good to choose a common font that's easy for people to read and makes you look professional. That can usually be Times New Roman or Garamond, but the one that we have in the example is not that, and it also looks good in my opinion. Avoid using tables or grids. This is something that can just make some of the formatting difficult. You're usually better off just starting with a blank Word document and putting some of the information in. So sometimes the formatting can get really finicky if you add grids, tables, things like that. So try to stay away from that if possible. Avoid abbreviations except for states. Sometimes people put in things like, let me see, like IEP or PPT meetings or things like that. So those are things that in my field we use all the time, but not everybody would know what that meant. So, and especially even going from like hospital to hospital, some acronym that is really common in one hospital might not be there at all in the other hospital. So try to avoid acronyms and instead write out everything. The one thing that should always be abbreviated are states. So we have Stewart CT for all of these. We have Manchester CT. So states should always be abbreviated, but pretty much everything else should not be. The one other thing that can be left abbreviated would be like something like SPSS. That's what we use in my field. I don't even really know what it stands for. And I wouldn't really know what it was if somebody wrote it out completely. So something like that is okay. No templates. So this is something that people come in with a lot and they'll have a template from Microsoft Word. Really recommend not doing templates just because it looks the same as everything else. It's really hard to fit your information into something that is already created. And sometimes when there are tracking systems, it can be difficult for them to read some sort of like image or something. There's one in Microsoft Word that has like a circle at the top, and if I see that one more time, I'm going to be very sad. So you're usually better off just starting out, like I said at the beginning, with a blank Word document, kind of follow a structure that you think looks good, but try not to take a template and try not to follow exactly what somebody else did because their experiences are going to be different. And their preferences for how things look professionally are also going to be different. So it should be a reflection of you and not somebody else. So here's some more general rules. So no typos. This is, it's really important to have a solid document where your grammar is good and your typos are not there. Try not to reply completely on spell check. I've seen a lot of people who have words that are correctly spelled technically, but it's not the right word for this sentence. And they were trying to say something else and the spell check didn't catch it because it's a different word. That's where getting your resume checked by a professional or a friend, even reading it over, could be really helpful. Another thing too can be printing out the document before you submit it. Sometimes it's easier to check for some of these errors when you're looking at a print document than when you're looking at a document online, especially if you've been looking at it for several days and you feel like you can't, spend any more time looking at it. That's when it's good to print it out and take another look. You might catch something that you didn't know was there. So use third person. So that should be, instead of saying I did this, I did that, my lab was here, my lab and I did these things. Resumes are always in third person, and that means no personal pronouns at all. So no I, my, he, she, they, anything like that. That's why when you look at bullet statements, they have things like provided couplet care to mothers and babies, and it starts out with a verb. So it doesn't say I provided care. Instead, they just start with the verb. So don't include any personal pronouns and start your sentences using a verb instead of a pronoun, even though if you added the I, pretty much all of these bullet statements, you could add an I and it would be a complete sentence, but in resume world, we recommend just starting out with the verb. It makes it a little bit stronger. So also pay attention to tense. With past tense, that should be things that happened in the past. So if you have an experience that has ended, you should write about it in past tense. So you provided care, you screened participants, things like that. And if you're doing it now, it should be in the present tense. So that's something to watch out for, especially when you're starting new experiences, ending old experiences. Make sure you change that tense. So here are some categories that are common on resumes. So the thing up at the top is the contact information. So that usually has your name, your address. That's something that isn't super common, or it's not as common as it was, or it's not as vital as it was. It's really up to you whether you want to include your address. People used to always include their personal address, but especially now in the internet age, it's not necessarily safe or recommended to put out your home address. And if you feel uncomfortable doing that, then go ahead and leave it off. Another option would be to do your professional address. So if you wanted to do your department at UConn, you could also do that. So I'm in the School of Education, I could put the address for the NEAG School of Education instead of my home address, and that would be totally fine. And then we have the objection, which is the next section. In this example, seeking a position as a registered nurse in a hospital setting using critical thinking, assessment, and interpersonal skills. So they're telling them what they're looking for and then some of the things that they can bring to the table. So, and those would be critical thinking, assessment, and interpersonal skills. For clinical resumes, and if you're applying to a practicum, a clinical rotation within your field, objectives really aren't that necessary. Objectives are more for if you're in one field and you're applying to another field. So if you were in some sort of educational field and you were doing a practicum, maybe you were looking to do it in a hospital, you might want to, that's not as common as doing it in a school. So you might want to have an objective statement where you say, I'm looking for work at a hospital to improve my skills in these areas and kind of show why it is that you're interested in going in this area. But if you're applying within your field, it's pretty well known why you're looking for these kind of experiences. So you don't really have to have an objective talking more about it. It can take up some space that you can probably use better elsewhere. Then we have an education section. These are all the educational experiences that you've had. This person also has a certification section that is usually a separate area instead of within the education area, but doesn't apply to everybody, but it usually comes right after the education. Then we have the experience section. This one starts with clinical experiences because it's a clinical resume. So in resumes, like in CVs, most important things first, things that are not quite as relevant next. Those persons decide that the clinical experience is the most important, so they are putting it first. And if they are applying for a clinical experience, that was probably a really good decision. So they have all of their experiences that they've had so far, and then they have some bullet statements. So bullet statements are the things that I talked on briefly in the last slide, where it tells the things that you actually did in these positions, and it starts with a verb. So provided continuous observation of critically ill patients and interpret patient data to reduce the risk of patient's deterioration. So those are the bullet statements. We recommend having anywhere from 2 to 5 bullet statements for each position. Especially with clinical resumes though, you can be doing a lot of different things. We recommend having 1 bullet statement per thing. So you're not saying like, I assessed, wrote up, counseled, collaborated with families in schools, because those are like 3 or 4 different things. It's better to do worked with students, assessed students, worked with families, and then talk more about each of those parts instead of having one really long line of information. So if you need to do more than 5 bullet statements, that's okay to do that. I think that 10 would be a lot, but I feel like 7 is probably okay. So use your good judgment with that, and also see how much room you have in a 2-page resume or a 1-page, depending on what your circumstances are, and then see if you want to add more information or not. And then we have at the bottom actually there aren't any other sections on there, but at the bottom you can see things like special skills areas or volunteer experience, leadership experience, research experience, if that's something that's relevant. Those are things that can be at the bottom. So let's look at some things about contact information. So that is the first thing that is always on the resume. It's always at the top of the document. A lot of things with resumes and CVs can be changed depending on what your circumstances are or how you want to represent yourself. But pretty much the one hard part of resumes is to have your contact information at the top so that they know whose resume it is that they're looking at. It includes your full name and your department or personal address. Like I said earlier, that is optional. And your phone number with an appropriate voicemail. I say that because you might be putting your cell phone or something on your resume. And if you have a voicemail that your friend recorded when you were at a party, it's not super professional and you probably don't want to have your future boss or your future supervisor listening to that. So make sure you check that voicemail before you put something personal on there. We recommend using a UConn email address or a professional email address. I wouldn't do, like for me, like horselover360@aol.com because it's a little bit unprofessional. So instead, I would probably use my UConn email. That's what we recommend because it's the most professional. You could also use a Gmail account or something like that, something that's that has your name and doesn't have something like horselover in it. And LinkedIn is not always necessary for clinical positions. For the most part, they don't really care. They don't really look into it. But if you want to add information into your LinkedIn information, if you feel really strong about your profile and you want to have it on there, that's definitely something you can do, but it's not completely necessary for these positions. So here are some examples of contact information. This one has it very condensed, so it's all on 2 lines. That's what this person did. They did add a LinkedIn. They have a phone number. Everything is on the same line. And this next one is quite a bit bigger and they have everything on different lines. Again, that is something that you can do based on how much room you have. Again, if you're trying to get it to the end of the second page, maybe you want to have something like the first one. And if you're trying to, or the second one, if you're trying to fit everything onto one page, you might want to use something like the first one. And then here's one that has pronouns if that is something that you'd like to include. All right, so here's the objective statement. We already talked a little bit about that, but it usually includes some of the position or the title to which you're applying, and then the field, industry, or institution, and then 2 or 3 transferable skills that you possess that are relevant to the position. So in the example that we looked at, it was like critical thinking skills, things like that. Yep, and some examples are clinical skills, interpersonal skills, leadership skills, verbal, things like that. So here are some examples. Like I said, I wouldn't necessarily recommend this because I think that you could probably use your space in a more productive way. But if you were applying to something that isn't super common in your field, or if somebody would be thinking, why is this person applying for this? You might want to have an objective statement just to clarify that for them. So here's another one. This is nice and specific. So to effectively teach students grades 1 to 6, inquiry-based elementary school environment, demonstrate utilizing demonstrated skill in instruction, as well as the ability to think and instruct creatively. So those are 3 different things and they're very specific. In my opinion, I think that this one is a little bit stronger than the first one that says seeking a position as registered nurse in a hospital setting, utilizing critical thinking skills, assessment and interpersonal skills. Those are a little bit vague. I like the one that's a little bit more about instruction and talks about like 1 through 6, inquiry-based classroom setting, a little bit more specific. So that makes it a little bit stronger. Here's another one, seeking a healthcare research administration position, utilizing technical organization and communication skills. So again, that's more like the first one. So you can definitely do one or the other based on your preference or not at all. So now these are some more information about education sections. So they usually include the location, degree, and graduation date. So it would be like pretty much everything in resumes, recommend starting biggest to smallest. So the biggest thing would be the university, and then the university's location. So for University of Connecticut, it would be University of Connecticut, Sturt CT, or the University of Connecticut, Avery Point campus, Avery Point CT, Groton CT. And then your degree would be something like Doctor of Philosophy in psychology, clinical psychology or something like that. And then your graduation date. So just the month and the year of when you graduated or when you will graduate. So you don't have to do when you started, you don't have to do when like to present. Pretty much we just recommend doing the date that you finished, the month and the year of when you finished. You can also add some other things. This is very optional. The first bullet point is really what we see very frequently in education sections, but you could also list things like GPA, honors and scholarship, relevant coursework, and graduate certifications, or theses. So if you want to put your master thesis or your dissertation, you could do master's thesis colon the title of the master's thesis. If you want to do honors, instead of having a whole section for honors, you could do honors colon and list some of your honors. So those are just some things other things you can put in the education section. Be specific about the degree. So it shouldn't just be like, for me, like I'm in the School of Education, so mine would be Doctor of Philosophy in Educational Psychology, but that's a really big field. There are a lot of different things in educational psychology. So I have Doctor of Philosophy in School Psychology, specialization, or Doctor of Philosophy in Educational Psychology, specialization, School Psychology, because I want to make it really clear what my specialization is in, because there are a lot of different things under the educational psychology umbrella. And then if this is something that is appropriate for your field, you could have a separate certification or exam section if appropriate. So I know for nursing or dietetics, nutrition, things like that, sometimes the certifications and the results on exams are really important. So you could have another section for that after the education section. So here are some examples. This person has a master's and a bachelor's, and they have them in two separate things. So they're both University of Connecticut, but they have they have one for the master's and one for the bachelor's. That's one way of doing it. As you can see on this one, they have their sub-plans. So they're talking about that their master's was specifically in elementary education instead of just having Master of Arts in Curriculum and Instruction. So that is very specific about their degree. This person decided to include their GPA. For the most part, that is optional. You're in grad school, so we know you're smart because you're in grad school. So you don't have to include a GPA, but if you would like to, you can definitely do that. I know that some clinical positions do prefer to have that information. So if that's the case, then you would want to include that. But if not, it's really up to you. They also have an inquiry project and they have the title there. And then at the very bottom, they have some of their honors. And this one, this is a different way of doing it. They have, this person has 3 different degrees from University of Connecticut, and they're all under one area. So if this person did it like the first one, they would be 3 separate degrees, but this person condensed it into one thing under the University of Connecticut because they are all from the University of Connecticut. They have that school psychology specialization, and that's about it. There's nothing else in there. If they wanted to, they could add something about their dissertation, their GPA, but this person is really keeping it very streamlined with the information in the education section, and that is totally fine. And then this one has the education for bachelor's in nursing, Bachelor of Science in Nursing, then they have that certification for the CNA in the 2 separate sections, but it's right at the top so the person can see that they do have that certification. Okay, so skills section. This is something that is either next after education, or it can be at the bottom depending on how important skills are in your field. So skills are measurable skills or technical skills such as computer, language, or laboratory skills. So it's not something like good conflict resolution skills, good teaching skills, good people skills, things like that. Those are not things that you want to put in your skills section. You're going to want to put those in your bullet statements instead, because it's one thing to say like, I'm really good at talking to people, but it's not really proved in the skills section. So you can really show that information more if you put it in your bullet statements. So skills are really things like SPSS, any laboratory skills, R, Python, things like that. You could also do languages if you speak other languages. If you do not have to put that you speak English, because we know you speak English because the resume is in English. And then laboratory skills can also be helpful. You can also put certifications in there. Like in the example, the CNA is a really important part of that person's resume, so they have it in its own section. But if you have something that's a little bit smaller and you feel like it shouldn't be as like in its own section, you could put it in the skills section. So here's some examples. This person has their certification, so it's not in the separate section like the person who is with the nursing degree did. They also have their computer skills, so they have their Microsoft Excel, Access Word, PowerPoint. So one thing that we say as well is to not do Microsoft Office, because there are a lot of different programs within Microsoft Office, and chances are you probably don't know all of them. And it's good to list the ones that you're familiar with, and those are things like Excel, Word, PowerPoint. I'm not familiar with Access, so I wouldn't put that on mine. And then they have some other things that look more specific to their field. And then they have languages, which is conversational and Spanish. If you want to put a language, but you don't, if you're not fluent or you want to emphasize your ability, you could put fluent, you could put conversational, or you could just put Spanish, depending on what you would like. This is another one. They have, again, some certification. They have the dates that they received it, because for CPR and first aid, the dates are really important to show it's still up to date. So that's something that you could do. This person has some computers, and they have their Spanish and their Portuguese in the language. This is another one that focuses more on the computer skills, and they have language as well. For the most part, for clinical resumes, I typically recommend having them at the end of the resume, because they're in some ways are not as important as some of the other things that you're doing. For the most part, people really want to showcase their skills in their different experiences, like their rotations or their practicums. So I usually recommend having them at the bottom, but if you have a lot of things that you really want to highlight, or something that would really help you in the position that you're applying for, then I would recommend putting them after the education section. All right, so moving along to the experiences section. So this is the big part of your resume typically. So this lists jobs, positions that you've held, including name of organization, location, title, and the time period where you were there. So we call those the big four. So again, we're starting biggest to smallest. So we typically recommend having the name of the organization. So if you worked at the University of Connecticut, you would say University of Connecticut, and then you could do the department if you wanted to. Or if you're working in a school, you could do like South Windsor High School, and then the location, which would be South Windsor, Connecticut. For UConn, it could be University of Connecticut, Department of Psychology, Stewart CT. So that's typically on the first line. And the next line is your title, then the time period where you work there. So that can be like May 2019 to May 2020. If you're doing it in the present, or if you're still working there, you could do May 2019 to present. It is important to have the month there, because it can show just how long you worked there. So if I said like 2014, I could be working there for 12 months, or I could be working there for 1 month. So it's really good to show just how many months of experience you have. And sometimes employers will count the months to see just how many like equivalent years you've been working. So try to include the months if you can. It's also better to do that than fall or spring if you were there for a semester, because in some clinical areas or in other places in general, they might not follow the same calendar as a UConn calendar. So you're better off usually putting in that month. It's also important to have the dates written out completely. Or not the months written out completely. So that would be like writing out August completely instead of just having Aug. It just makes it look a little bit more professional. And it also goes back to what we said about not having any abbreviations besides states. So make sure you write out your months. They include all relevant experiences. So this is where you should look through your master CV and think, what is relevant? So if you have some things on there that might not be as relevant for some clinical areas, you might want to keep those on your master CV and save them for an experience where it might be more relevant. So these could be things like projects in class, they could be previous rotations, they could be volunteer work, whatever you think is relevant. So here are some examples. So this person has Danbury Hospital, and they also have the Manchester Hospital. They have some bullet statements in there. So like we said earlier, bullet statements should typically be around 2 to 5, but they can be more if you need to, basically. With bullet statements, we recommend having the what, how, and why for bullet statements. So what did you do, how did you do it, and why did you do it? So this person has developed patient and post-discharge care plans in collaboration with the supervising RN. That is what they did. And then actually the part where they say in collaboration with the supervising RN is also how they did it. So it's saying like how they actually made this thing happen. And then to assist in the recovery, that is why they did it. So that's a really strong bullet statement because it shows each of those areas. And then there's another one too that says utilize communication skills to build relationships with patients while listening to and interpreting their needs. And that would be the what is utilize their communication skills, and then why, instead of at the end, it's in the middle this time, to build relationships with patients, and then how they did it while listening to and interpreting their needs. So that is also hitting the what, how, and why, just in a little bit of a different area. The why can be really helpful to include because it gives the really whole picture about why you're doing this in the first place, but sometimes it can get a little bit repetitive. So if you feel like it's not appropriate to include the why in every single bullet statement, that's something that you can take off. Here's another example. They start off again with the place where they worked, and then they have the actual location, and then they have a very specific title that they had, and they show that they were in like the oral language development with guided reading rooms in grade 1, so it's nice and specific and shows like what levels they were working with, and they have the dates as well. And then they have some more bullet statements. So they have conduct research for inquiry project on oral language development and guided reading groups. So conduct research, that's what they did. Why they did it would be for an inquiry project on oral language development. How would be in guided reading groups. So again, try to hit the what, how, and why with all of your bullet statements. Another thing too, up at the top with in the Danbury Hospital experience, they have the number of hours that this person worked. And that's something that is important in some fields. So if that's something that you have to have a certain number of hours in each area, that's something you might want to include on your different experiences. That's going to depend on your field, and that's something that you should check on before you start making your resume or your CV. And then we actually already talked about this. So bullet statements are 1 or 2 lines that describe what was accomplished or learned in a certain experience. They should always be 1 sentence. It shouldn't be more than one thing. Sometimes people will say like, I researched this, period. Research determined this, period. Those are 2 things that should really be just 1. So if you find yourself having more than 1 sentence in your bullet statements, try to condense it or split it up into 2 different things. And the general idea is to allow the reader to understand how each of the experiences relates to the one that you're applying to. So they also typically begin with the action verb. Again, that goes with having the 1 sentence. So provide counseling for students, support the coordination of, develop patient plans. So those are some areas that you can think about when writing your bullet statements. They should always start with a strong action verb. They also don't have any personal pronouns, like I said, so it shouldn't be I develop patient care plans. It should just be develop patient care plans. And then also pay attention to tense. Again, this is something that can be tricky, especially when you have a lot of different experiences, but make sure you check that before you apply for new positions. All right, another thing is to quantify wherever possible. So if you say like the number of people you supervised or mentored, so if you are in a supervisory role, you could say like supervise 5 students. That is different from if you just said supervise students. That could be from 1 student to 100 or more students. So if you really show the number of students that you worked with, that makes it a lot stronger. So you could also say that you had 100 patients, that you had 30 students in your class. Those are things that will show a little bit more information about what you actually did in these experiences. The ages of the population can be important, especially if you're working with younger people or older people. So ages 3 to 5, age 60 to 80, things like that, that can really show the ages and the range that you're working with, especially if you're specializing in any specific age. Another thing that you can do too is the number of counseling or assessment cases. So you could say, did counseling with 10 different students or completed 10 different assessment cases. That gives more information about what you actually did in this experience. Another thing too could be the number of patients or beds. You could say that you worked in a hospital with 200 beds or something like that, and that can give an idea of just how big the hospital was or how many patients you were working with. You can also talk about the treatment techniques that you use. This can be important. So you could talk about blood draws. You could talk about any other things that are appropriate. You could also say for interventions, like you did a reading intervention, you did a intervention for anxiety, things like that. You could also mention the specific ones. All right, so now we are going to move on to CVs. So like I said earlier, CVs are really everything that you've done, and resumes are really distilling it down to something little, or something that is more relevant to the position and is a lot shorter and more compact. So it's usually over 2 pages. It's 3 to 6. I've also worked with people who've had like 75 pages after they've been a researcher for a really long time. But for the most part, they're over 2. So once you get into the 3 realm, that's more of a CV, and it can go up from there. The order in which you choose to present reflects your focus. So if you're applying for a clinical position, you might want to have that first instead of your research and teaching. If you're applying for a teaching position, you probably want to have your teaching experience first. The style also varies from field to field. This is something that you could check with your advisor or any of your supervisors to see what their CV looks like. That does not mean that you should steal their CV structure and make it fit into yours. That's where, like I said in the beginning, you're usually better off starting with a blank Microsoft Word page and a general structure of something that you think is professional, and going from there, because their information is different from yours and you really want to do what works for you. It's important to have faculty in your discipline review it. If you brought it to something like the Center for Career Development and scheduled a career coaching appointment to go over your CV, somebody like me wouldn't necessarily know what the norms are in your field. So it's important to talk to people in your field and see what the norms are. It's also important sometimes to find younger faculty or younger people in your field to review your CV, because if you're talking to your researcher who's been in the field for 40 years, things might have changed a lot since the document that they submitted for their position. So here are just some additional sections in CVs. So these could be things like mentoring, leadership, publications, presentations, teaching interests, grants, patents. Basically, you could add any of these into your resume if you would like to, but again, 1 to 2 pages. You really have about 2 pages to play with. And if you have a publication or you have a presentation that's really similar to work that you'd be doing, or you have the opportunity to present at a conference or something in these positions, that might be something you want to put on. If not, maybe that's something that you'd like that's more appropriate to leave off for that application. So really think about what is going to be applicable to what you're applying for and not all the experiences that you've had, because you probably had way too many to fit into 2 pages. But these are some other things that you could put on a resume, or these are the other like special CV sections that we don't typically see on an average resume. So here are things that you should retain from your resume. To be honest, CVs are pretty much resumes but longer. So you really should retain your contact information, your education, your relevant skills and training, and your relevant and recent experiences. People all the time will ask me, or I'll tell them to add bullet statements, and they'll say, well, if my advisor doesn't have bullet statements. But we really recommend having those bullet statements that talk about what you've done. Your advisor might have been in the field for like 30 years, and they already have a job, and you are looking for more experiences or for different positions. So it really is important to have those bullet statements on there to really show what you've done. So should you have a CV or a resume for applied clinical positions? So it really depends. I've had for some clinical positions, they have specifically asked me to submit a CV, so I have submitted a CV. But in most situations, people use resume and CV interchangeably, even though they are different. So it almost always is a resume, just because you don't usually have to have all the information that's on a CV for these clinical positions. So make sure you're looking at the expectations and following what they want you to do. If they really want you to submit that CV with any publications or presentations, then you might want to do that, or you should definitely do that. But if it's just your CV or resume, you should probably apply with the resume. That's usually more appropriate for clinical positions. So here's an example of a 2-page resume. We have the contact information, objective, education. This person has a certification, then lots of clinical experiences, and they have some related experiences. So those are things that aren't necessarily clinical, but it's still relevant to what they're applying for, so they still have it on this resume. And then they have their conferences and presentations. So some people will say that you should never have conferences or presentations or publications on resumes. I disagree, because I think it really shows your ability to speak publicly, or your writing ability, or if you have something that's really similar to what you're applying for, you might want to have it on there. So this is an example of how somebody has put some of those things onto a resume. They also have some activities. This is something that you could put on there if you want to. Again, this person is getting to the end of the 2 pages. This is also an undergraduate example. So if you're a graduate student, you might have a little bit more experience than this person. So you might not want to have that section. And then all the way down at the bottom, they have that skills section. So this person has decided that it's more important to focus on the clinical experience than to have the skills after the certification section. So instead, they have it here at the bottom. So that concludes this presentation on clinical resumes and CVs. Please consider booking an appointment with the Center for Career Development to further develop your career plan, and know that we are available to help you as you explore and pursue options. As a final note, you will be emailed a recording of this webinar in the next 24 hours, and a brief evaluation will pop up at the end of the webinar. Thank you for listening and all the best as you continue on your career journey.